Hi everyone, I'm Dr. J, the Executive Director of the Wellness Center, which includes the departments of Accessibility Services, Counseling Services, and our Health Education Resource Office. And I am here to talk to you today about resilience. So I want us to kind of reflect on the last year and think about how chaotic everything seemed, right? Was, not just seemed, was. Life doesn't always come with directions, unfortunately. So everyone experiences various and unexpected twists and turns, from everyday challenges to bigger traumatic events that have a longer lasting impact. Each of these changes affects people differently. So it brings up unique emotions, thoughts, a lot of feelings of uncertainty. But in general, over time, we find that people tend to adapt pretty well to stressful situations, even if they're life-changing. And part of that is due to this idea, this concept of resilience. So psychologists define resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or other significant sources of stress. And that can include things like family and relationship problems, serious health problems, or workplace and financial stressors. So when we think about resilience, a lot of times people think about the idea like, oh, we're going to bounce back, we'll get back, right? The new norm, people were calling it, related to COVID. Resilience does involve a bouncing back from difficult experiences, but more than that, it involves, and it can involve, profound personal growth. So I want to clarify real quick that being or cultivating resiliency doesn't mean that you're not going to experience any emotional pain, difficulty, or distress. Adverse events in your life are painful. They're certainly going to evoke painful emotions. That doesn't mean that they have to determine the outcome of your life. So in spite of there being many obstacles, there are still aspects of life that you can continue to control, you can modify, and you can grow through. That's where resilience comes in. Becoming more resilient, it doesn't just help you get through difficult circumstances, it empowers you to grow and improve your life along the way. So resilience isn't something that people just possess. It's something you have to learn and develop. Anyone can do it. Anyone can learn and develop resiliency. It's just like building a muscle. It takes time, so patience is key. And it takes effort and intentionality. You have to want to develop these skills. They're not just going to come simply because you're like, ah, hey, resiliency, let's do it, right? You have to be active. And so there are 4 core, I guess they're calling them components, right? When I was looking up, oh, what exactly do I talk about resiliency? It's such a big, broad topic. Kind of saw this, according to the American Psychological Association, this document that kind of breaks it down into 4 components. So to increase your capacity for resilience to weather and grow from the difficulties, you want to focus on things like connection, wellness, healthy thinking, and meaning. So I'm going to break each of those down a little bit right now. When we think about connection, it's exactly what it sounds like. I need y'all to prioritize your relationships. Social connection is so imperative to resiliency. Connecting with empathic and understanding people can remind you that you're not alone in the midst of difficulty. So this doesn't just mean any sort of connection. It has to be a meaningful connection, right? You want to focus on finding trustworthy and compassionate people who validate your feelings, who validate what you're going through, and support you through the difficulties. I don't know about y'all, but sometimes, when people go through difficulties, they start to isolate themselves. They pull themselves away from the people that they love, the people that love them most. And that can lead to other difficulties. So it's important that you learn to accept, help, and support from those who care about you. So make sure that's a priority. When it comes to wellness, that's something that we fully embrace here at the Wellness Center, right? And we approach it from we say it's a holistic approach. We approach it from different avenues to wellness, right? So the first is to take care of the body. I think when we think about wellness, we think about taking care of our physical self, right? So self-care has kind of become a buzzword. What do you do for self-care, right? But it is legitimate. It's a legitimate practice that can help build your resilience. So stress is just as much physical. It affects us physically as it is mental. It affects us mentally, right? And emotionally. So promoting positive lifestyle choices, adopting healthy habits, physical habits, right? Like proper nutrition, ample sleep, staying hydrated, moving, make sure that you're incorporating movement into your day, strengthens your body and your body's ability to adapt to stress, and therefore reduces the toll of emotions like anxiety, depression, anything that might come from a stressful situation. Another way to practice or foster overall wellness is to practice mindfulness. So mindfulness, I've talked about it a lot in various settings, but just want to remind you that the practice of mindfulness is being wholly connected to the present moment. Oftentimes our mind is in the future or it's in the past, things that have already happened or things that are about to happen that we feel like we need to plan and prepare for. And we're not really grounded and rooted in the present moment in what we're doing right now. So things like deep breathing, grounding exercises, yoga, or spiritual practices like prayer and meditation help remind us where we are in the moment, and therefore connecting us to what we have control over. That's important. Remembering what we have control over will reduce stress because we know what to focus on. You can also practice gratitude. This is a huge thing that I encourage. It cultivates not only resilience, it cultivates happiness. So when you do things like journal, meditate, pray, it's really important that you ruminate on the positive aspects of your life and recall the things you're grateful for. Even in your personal trials, even when times are tough, force yourself to identify something positive. Our brains are like Velcro. It's called the negativity bias. Our brains are like Velcro when it comes to negative aspects, negative comments, negative things that have happened throughout the day. And they're like Teflon for positive things. That just means that we have to pay more attention to the positives. We have to attend to a positive comment, a positive situation, a positive interaction for a longer period of time so that it's registered in our brain and we remember it. And that is something that we can recall and experience happiness about at a later time. So practicing gratitude, making sure that once a week, you're jotting down 3 to 5 things that happen that you're really grateful for. And make sure you're switching it up. If you are grateful, if you kind of get in this routine where you say you're grateful for the same thing, it's not going to have the same effect. You really have to be paying attention to unique things that happen throughout each week. And the last thing I want to talk about for fostering wellness is avoiding negative outlets. So this is definitely coming from a non-judgmental place. I'm not sitting here to lecture or point fingers at anybody, but I want you to think about how negative outlets like alcohol, drugs, unsafe sex, or just other unhealthy outlets mask pain. It's almost like an attempt to put a bandage on a really deep wound, right? These outlets usually serve us as an avoidance technique. They help distract us and avoid the situation that's at hand. So it assists us, it's helpful, but really temporarily, just for a moment. And then the long-term consequences of continuing to engage in these unhealthy or negative outlets can be more detrimental. So focus instead on giving your body, your mind, the resources to manage stress rather than simply trying to eliminate the feeling of stress altogether. The third component to resilience is healthy thoughts, embracing healthy thoughts. And the first way to do this is to try to keep things in perspective, which can be really difficult when we feel like all of these things are happening. Taking kind of like a step back and having an objective view of the situation is tough. It's tough, and it takes practice to be able to do that. So I want you to know that how you think plays a significant role in how you feel and how resilient you are when you're faced with obstacles. So try to identify any unhelpful stories that live in your head, unhelpful stories that live in your head, right? The ones you tell yourself and you tell others about your life, and critique it, break it down, right? Figure out how you can adopt a more balanced and healthier, helpful narrative. So for instance, I have this example written down. If you're feeling overwhelmed by a challenging course, remind yourself, right, that your performance on past assignments and grades doesn't have to be an indicator of how your future will go, whether that's the future in this course, your academic future altogether, right? And recognize that you're not helpless. You might not be able to change a highly stressful course, but you can change how you interpret and respond to it, like through planning, tutoring, communication with your professor, right? Planning even further in the future. It doesn't just have to be short-term planning. Sometimes when things like that happen, we think it's the end of the world, everything's falling apart around us, right? And then when that sort starts to happen and we have that mentality, it's like we become stuck. We don't know where to move. We don't know what to do. If we took a deep breath and said, wait, let me try to keep this in perspective. It was just one assignment. It was one semester. You can get back. You can do it. Let's figure out how. Let's take some small steps, which we'll talk about in a little bit. Another component or another key part of the component of embracing healthy thoughts is accepting change. Well, look, y'all, we don't like change. We don't like change. I mean, we'll go into a classroom, right? This happens at home too. Like, I have the space where I sit in a classroom. I have a space where I sit at home. I do certain things in certain places. That's just one example of how we don't like change. So accepting change is difficult, but it is also a part of life. So certain goals or ideals may not be attainable as a result of adverse situations that have come up in your life. Accepting the circumstance cannot be changed, can help you focus on the circumstances that can and what you can do about those. So that's not to say that we don't validate that it's disappointing, that there's grief related to the fact that there has to be change. There are all of these emotions that come with that, and we can validate and acknowledge all of those. And we can also look at, okay, so what can we do from here? What do we still have control over? And how do I make movement in that direction? Kind of accompanying that is maintaining a hopeful outlook. So it's hard to be positive when life isn't going your way. A more optimistic outlook can empower you to expect that good things will happen to you. And one of the things, I actually don't tell many people this, but one of the things that we find in counseling is that expectancy is really important to whether or not you make progress. If you don't think you're going to, it's more likely that you won't, because you're not putting forth the effort. It leads to a whole bunch of things. So you have to expect that things can get better. You have to think it's possible. I can do this and it will happen. So try visualizing what you want rather than worrying about what you fear is going to happen. And again, we talked about the negativity bias before. You have to pay attention to the positive changes that occur, right? Don't always get hung up on the fears or the change that you didn't like. You have to pay attention to the positive that comes from it too. And the last piece for embracing healthy thoughts is learning from your past. So one of the things I want to be really clear about is that this is not a space where we invite self-criticism. When we look at our past, it's not to be judgmental or critical of the things we've done, choices we've made. That's not going to be helpful at all. That's going to make us feel terrible, and then we're going to be stuck again. We don't want that. We want to learn from our past to help us get to where we need to go, right? So by looking back on who or what was helpful during previous times of distress, you can discover what would be effective in this situation, right? What was effective for me before? Maybe I need to implement that again, right? Who was helpful for me? Who could I rely on? Maybe I need to utilize those resources again. So remind yourself of where you've been. Find the strengths that happen from that situation. Ask yourself what you've learned, and then ask yourself how you can apply it to this situation. And the last component is finding purpose. So when things are going terrible, we want to build resiliency. We want to be able to bounce back and grow through adverse periods of our life. One of the ways to do that is to find purpose. How do you find purpose in life? Helping others is a huge component. Altruism, so meaningful. Most of us get satisfaction from being able to help others. So whether you are doing formal volunteer work or you're supporting a friend in their own time of need, You can garner a sense of purpose, foster self-worth, connect with other people, and all of those empower you to grow in resilience. You can also try to be proactive, right? So, like I said before, it's really helpful to acknowledge and accept emotions and validate the emotions that happen during difficult times. But it's equally as important to ask, okay, I'm having these emotions, and what can I do? What can I do about this situation? And then once you come up with what you can actually do, a realistic, I guess, goal of what you can actually do, you want to break it down into manageable pieces. So taking initiative will remind you that you can muster motivation and purpose even during stressful points of your life, which increases the likelihood that you'll rise up again when stressful or painful situations happen in the future. Again, so this is beneficial both in the moment, but also in the future when difficult situations happen. Moving towards your goals kind of piggybacks off of being proactive, right? So I said setting a realistic goal. That's really important. Sometimes we have these very overarching goals, and it's not that they're not accomplishable. They're definitely accomplishable, but we're not going to accomplish all of it overnight. We need to break it down. I often talk with people about SMART goals. I know I'm not the only one who has said this across the university. SMART goals: specific, measurable, attainable, realistic, and time sensitive. They have to be very specific in nature, right? The first example that comes to my mind is like, I want to incorporate more movement into my week, right? That in and of itself is not it's a good overarching goal, but it's not a good goal that's going to help me get to where I need to go. I need to get specific. How many days a week do I want to incorporate movement? For how long? Which days of the week? At what time of day will I be doing this? The more specific, the better. Measurable. Giving myself in that example, giving myself the 3 days a week. That's measurable. There's a way that I can look across the week and say, yep, I am at this goal, or nope, I still have some areas to grow. Attainable. I have to look at my schedule maybe and, right, specific, measurable, attainable. Yeah. I have to look at my, and this kind of piggybacks off of, it's both the A, attainable, and R, realistic. Look at my schedule and say, is it even feasible? Can I really do this? Do I have time 3 times a week right now? Maybe, maybe not. If not, make some adjustments, right? Do I have everything that I need? Is everything in place so that I am able to incorporate movement through exercise, right? Do I need some sort of exercise equipment? Do I need a gym membership? Do I need a safe place to walk? If I have kids, do I need someone to take care of the kids, right? All of these sorts of things come into play when you're trying to develop goals that you actually are able to achieve. And then T, the time sensitive piece, right? Gave myself the week. By when do I want to accomplish this goal? Set a deadline for yourself. It's always really helpful. And the last piece of the finding purpose component of resilient is to look for opportunities for self-discovery. So this is really important. I think that there are times we don't like to engage in self-reflection. Sometimes we're worried about what it's going to bring up. Sometimes we're just too busy. We're emotionally and mentally drained. And I understand all of those things are really important. A lot of us are feeling burnout right now, so I'm not suggesting that you add something else to your plate if that's where you're at. But if at some point when you find that you have the mental and emotional energy to do so, I would encourage starting a pretty regular practice of self-reflection, because people find oftentimes that they've grown in some respect as a result of a struggle. So, for example, after a tragedy or hardship, people have reported better relationships and a greater sense of strength, even while they feel vulnerable. That can increase our sense of self-worth and heighten our appreciation for life. However, if we're not taking the time to reflect, there's a lot of times where we don't recognize it. It's not as impactful if we're not being intentional about the reflection, seeing how resilient we've actually been thus far, how we've grown, all of our accomplishments. Those things build confidence. That builds resilience and hope and perseverance to continue moving forward and knowing I can get through this. I've gotten through this. I've already grown this much or in this way. You have to reflect on that and make sure that you give yourself credit, because I know a lot of us are really critical. So you really have to give yourself credit where it is due. The last thing that I want to leave off on is that getting help when you need it is crucial in building resilience. So there are going to be times when using your own resources and the kinds of strategies that I just talked about will be enough for building resilience, right? But there might be other times when you're feeling stuck or you're having difficulty making progress in or on the road to resilience. So use your support system. If you find that that's not enough, seek out help from a licensed mental health clinician. We can assist you in developing appropriate strategies to continue moving forward. We know you have what it takes. We're just there to help either remind you and help you kind of stay on track, help you potentially discover things that you didn't recognize before, right? So keep that in mind. The important thing is to remember that you're not alone. You're not alone on this journey, even though sometimes you probably feel alone. You're not alone. And though you can't control certain aspects of really stressful or traumatic situations, you can grow. It's possible. And it's a more pleasant and easier experience if you have the support of loved ones and trusted professionals by your side. So I will talk more about resiliency, at least a little bit during the virtual portion of StudyCon. So I hope to see you all there. If you have any questions or concerns, you want to chat more about resiliency, or you just want to reach out, please feel free to do so. The best way to contact me is via email at wellnesscenter@ollusa.edu. Thanks everyone. Take care.